My name is Alyssa Singh, and I will be presenting a case from our course material, Chapter 7, on a somatic trauma case. The client for this case is a 35-year-old female experiencing difficulty focusing on a training in the city due to experiencing trauma in that city 3 years prior while she was living in that city. The trauma had not yet been resolved and was thus being triggered by being in the same city, seeing familiar sights, and memories over time there were flooding back. The client does not go into the traumatic event itself in this case, but only the reactions that her body was having when thinking back on her time there. These bodily responses included increased blood pressure, shallow breathing, difficulty focusing, anxiety, feeling tearful, hot, even shivering in the body, and panic. While discussing the bodily responses to the trauma, the client also discussed some of the good memories that she had in the city that offered her a feeling of pleasant warmth. It also had the effect of slowing her heart rate, breathing easier, and experiencing a deeper sense of calm. In thinking back on the good memories, the client noted the friendships that she had and her like for the botanical gardens. She said that in thinking about the good memories, she felt a bit more sturdy and strong, and that even the memories of the trauma became a very small echo. Some positive aspects of her time in the city included her work, her colleagues, developing in her profession, and her feeling of experiencing a lot of support and encouragement. Some of her presenting problems, obviously, was including just some issues due to her past unresolved trauma. Having that being triggered, she was experiencing increased anxiety and an inability to focus on the present. This also ended up being somewhat of an occupational issue, in that the increased anxiety and triggers of her past trauma was also making it difficult for her to focus on the present task at hand, including the conference that she was attempting to attend. Some of the treatment goals offered in the case was to reduce feelings of anxiety caused by past trauma so as to function more freely in the present, and also to learn techniques or coping strategies to deal with the anxiety when memories of past trauma did surface or were triggered. Some of the interventions that were already used within this case study included somatic trauma therapy and the use of CBT, so as to allow the client to just have a better understanding of her bodily responses to memories of the traumatic experience. And then through CBT, kind of taking a snapshot picture of her traumatic experience, not like a movie reel, but just a small piece of it, experiencing just the anxiety and negative bodily experiences, and then quickly moving to a good memory, and then really going in tune with her bodily responses to the good memory, and then superimposing those positive impressions upon her traumatic impressions, thus eliciting more of a positive bodily response and a lowered level of anxiety. These two techniques helped to alleviate the anxiety and also offered the client helpful coping strategies. However, if the client did desire to process and deal more deeply with the traumatic experiences themselves, I would probably approach it with a CBT or REBT approach, really examining the thought process involved with the trauma, and then just the thought process that she has had post the traumatic experience, and how that is still affecting her daily life in the present. I would also possibly use the narrative emotive approach, allowing the client to re-examine the trauma, but in light of a story where the traumatic experience is in the past, and that there is still hope in life after that traumatic experience. If the if the client was open to it and desired a spiritual aspect to the counseling, I would probably offer up the idea of using spiritual meditation such as Lectio Divina, and really emphasizing scriptures focus on the Lord's faithfulness, on the Lord's protection, and on the Lord's love. Just really allowing the client to find comfort and strength and a strong foundation in just the unchanging character and nature of the Lord, where even when other things are uncontrollable, that we can always stand strong on who He is. I would also encourage just the creating of space in that Lectio Divina to really become more in tune with her own body and somatic expressions. So it's just be more in tune with herself. Alongside that, I would probably encourage the client to also keep a journal of thoughts, feelings, and emotions that surface during these exercises, as well as just the counseling sessions and the times that she really was working on processing her traumatic experiences, just so that she could better track the growth that she really was experiencing, and thus gain even more hope and strength in continuing this process. In conclusion, one of the greatest challenges that a lot of therapists are even debating to this day is just the benefits or the downfalls to bringing a client to really cathartically express their past emotions tied to a traumatic experience. Some think that this catharsis is helpful and allows clients to really be able to process and move forward, while others believe that it can really re-traumatize and thus make the situation even more difficult to deal with. I believe that this is probably on a case-by-case basis, where the client and the traumatic experience needs to be taken into consideration as to whether going through it again would be beneficial. But if so, I would again use a narrative emotive therapy approach, while also using CBT or REBT. Research has proven that the narrative emotive therapy approach does have very positive outcomes when dealing with clients dealing with PTSD, high levels of anxiety, and depression. If, however, the goal was simply to be more functional with less anxiety, I believe that the use of somatic therapy and CBT used already in this case to superimpose more positive memories upon the traumatic memories would have a successful outcome. And this is my case presentation. Thank you so much.